Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then we have a superior orbital fissure. Okay, now this is superior orbital fissure. So in the same picture, now if you see the superior orbital fissure, the superior orbital fissure is actually formed at the orbital apex. It is formed at the orbital apex, that too lateral to the optic foramen. Optic foramen will be somewhere here. It is formed lateral to the optic foramen in between the two wings of the sphenoid bone. So this is the uh, superior orbital fissure. This is the optic canal. Lateral to the optic canal, here you will see the superior orbital fissure. This superior orbital fissure is actually has a tendinous zin. So within the tendinous zinc tendinous ring or tendinous within the tendinous ring, we have the branches of the like the branches of the abducent nerve is present within the tendinous ring. We have superior division of oculomotor nerve and also inferior division of oculomotor nerve. All these are present in the um, tendinous ring, and also there is also presence of nasociliary nerve is seen. See, this is the superior division. So this is the superior division of oculomotor nerve. This is the inferior division of oculomotor nerve. Nasociliary nerve and abducent nerve are present within the tendinous ring. Then there is also above the tendinous ring or superior to the tendinous ring. Here you have the LFT. L is lacrimal nerve, F is frontal nerve, T is trochlear nerve. Along with that, we have superior ophthalmic vein, and we also have recurrent meningeal branch of ophthalmic artery is also present. So if we label this superior to the or above the tendinous ring, we can say above the tendinous ring we have superior ophthalmic vein, lacrimal nerve, frontal nerve and trochlear nerve LFT, and we have recurrent meningeal branch of ophthalmic artery. Now below the tendinous ring. Now if you see below the tendinous ring, we have only one group, that is inferior ophthalmic veins are present below the tendinous ring. So these are the contents of the superior orbital fissure.
thank you and thank you for watching.